Hi guys, it's Nicole from the Physio crew. Hopefully I'm not going to trip over because I am in the woods at Abbottsley. Had to bring the dogs because unfortunately our dog walker had a funeral, so in some ways that's awful for her obviously, but for me I got to have the dogs here, which gives me an excuse to get out every few hours to go and take them for a little walk and a run around the woods, which is really nice. It's had a busy morning in Hydro today. I have seen lots of different types of people. So I've seen people with Parkinson's, I've seen people with who've had road traffic accidents and had massive trauma. I've seen people who have had work-based trauma, which has included things like hip fractures, leg fractures, nerve problems, back problems, fractures of the ribs, fractures of the back. So I always love Hydro. It's amazing to be able to see people progressing, and also I've had some neuro patients. So the Parkinson's, I was helping him a lot with his balance, and then the lady who I saw following a stroke, I do a lot of stuff with her to re-educate her postural system so that she can sit independently. Well, that was what we did right at the beginning. She now can walk independently, which is just great. And so I thought I'd do a quick training video on sleep. Now I'm sure I'm boring you at the moment every single day with sleep. But I have been doing, in fact I've seen way more patients than that, because I asked 2 other patients about sleep today. So it's also back pain, and also a lady who had kidney failure who I've been getting walking in the pool, getting exercising, and helping her recover after a long stay in hospital, and just keep them really fit as well. And so the sleep patterns that most people are reporting are that they're getting under 6 hours or under 7 hours. And what we know from this book that I've been telling you all about, it is really important to get 8 hours sleep a night. And I've just, like I said, you need to read this book. It's completely blowing my mind, and I can't really translate it as well as the guys, because he's obviously a sleep expert, and I'm just learning it from a book, so I hope I don't get anything wrong. But he was talking a lot about PTSD and so post-traumatic stress disorder, and about how people are affected. I'm just going to hold that one, I'll call you back in a minute. And it was talking about people who have PTSD and when they're getting their repetitive nightmares, and it was talking about the role of noradrenaline in that. And this guy actually stumbled across, he was at a conference with another sleep expert who was doing a study, who'd come across a medication that helped to suppress noradrenaline, and then that enabled the process that was needed for people to actually recover. Because this particular guy, Matthew Walker, who's writing this book, he's proposing that sleep acts the REM part of sleep, and when you're in that part of sleep, the dream part is acting actually to suppress and give you therapy. So it used to be that they thought that dreams were just a reenactment of the day, so because often we can relate it, but they think now actually that it's related to the emotion. So the emotion, you remember, that's why we dream if we're feeling stressed about a problem, and we think, oh, I can relate it to that. But they think that it helps you to take the emotion out of it so that you recover. What they think with people who have PTSD is that that doesn't occur, and I'm sorry that if I'm saying things wrong, because I'm telling you secondhand from reading this book. You need to read the book, that'll tell you more about it. But how amazing that if someone is getting these night terrors and it's due to this, the change in the noradrenaline being released, how amazing for those people if we can look and find medication that will be able to get them away from those night terrors. And only this week alone I've been talking to people, I've been asking everybody about their sleep. I know that I'm a physio, but I want to know that people are getting it, because this is something that we can change really easily to get people to sleep 8 hours with professional help. It's something that can be implemented. Most of us could sleep a little bit longer. Sometimes we induce it ourselves as lifestyle choices, but sometimes it's not a lifestyle choice. Sometimes you need extra help. You need to be seen by a sleep specialist. I'm not a sleep specialist, so don't try and come and see me for this. I just want to get all this information out there so that people know where to go and get the help. I mean, that's the biggest thing with physio that I find frustrating, is I see people like down the line, it might be 1 or 2 years post the injury, and I'm like, why did no one tell you at the beginning? Why did no one understand? Why did the doctor not say to you, like, go and get physio, that's the right thing for you? And what I want to do is not just for physiotherapy, but for other things as well, be able to educate people and tell them, this is when you go and see a consultant, this is when you see a GP, this is when you go and see a nurse, this is when you go and see a pharmacist, so that people, you know, if you need certain types of medication, you can go and see a pharmacist for that. You don't need to waste the doctor's time. If you need, for example, cognitive behavioural therapy, you want to see a specialist in that area. And sometimes it's just having the education, because you don't know what you don't know. So if you don't know, oh, I could see a clinical psychologist, how are you ever going to like ask that question to the GP? Like, will a clinical psychologist be a good person for me to see? Would a physio be a good person for me to see? Would a sleep specialist be a good person for me to see? Like, if we empower patients to help with those decisions, the GP, of course, has to guide, and they have the hardest job of all, because they have to kind of work out what is going to be good for what person, and each of them has their own different unique experiences as well. But coming back to that sleep, I mean, it would be amazing if we could help people who are struggling with night terrors, who aren't sleeping because of that fear, that they're reliving it every single time. If we can find treatments to help them, that's got to be a good thing. And also for society, like, not just for the person. Of course it helps the person, that's really, really important, but it's the families, the kids, the broken families that happen following PTSD, the kids that get to spend time with their father or mother who is struggling. And for that person to then live not just a suboptimal life, like, who wants to live a suboptimal life which is, completely suppressed by something in the brain? What we want to be doing is we want to be educating ourselves about the brain. We want to be looking at different opportunities, and rather than feeling disempowered and thinking, oh, there's nothing we can do, we want to empower people so that they make those decisions to have the best quality of life that they can. And we all make choices in life. That's part of it. We choose whether we want to exercise every day. We choose. So we're making a choice about our health. We're making a choice if we try and sleep 8 hours, or if we just actually, like I said, some people actually find it difficult to sleep that amount of time, in which case you need to get support. But for someone like me, I can sleep 8 hours. Sometimes I'll choose not to. Like when I do my Bristol clinics, I'll often be up at 5, but do I go to bed earlier the night before? Not really. I just do what my normal routine is, because I want to do whatever, I might be chilling out, maybe watching TV for an hour before I go to bed. We make these decisions, and what I want to do is just empower people to make decisions based on science, and actually for people to take responsibility for their health, so that, people are always saying, oh, pressure on the NHS, diabetes, type 2, most type 2 diabetes is reversible and preventable. Like, that's your responsibility. You need to be doing things to keep your health. Like, don't get to 50 or 60 and be like, oh no, I've got all of these problems and it's really difficult for me to deal with them now, because it's your life, it's your health, and there's things that you can be doing to help that, and it's your choice, and you have to choose to go. So yeah, this sleep book, guys, I can't say enough, it's amazing. It'll blow your mind. You should definitely read it, but also just think 8 hours of sleep a night if you can. If not, then look at seeing a sleep specialist. And that's not someone who's done a 6-week course. Like, we need to get away from this kind of, let's just go and see any random person who's not qualified. Like, it needs to be a certified board certified doctor who's a specialist in sleep. Like, that's who it needs to be. So don't, there's people that can help who aren't in those settings, but quite often when you're looking at the brain, it is complex, and you can't, just, for example, let me use this. So if you go and see, there's clear evidence now that we know that if you go and see a doctor and they give you an injection and they say, oh, this is going to hurt, and if they say this won't hurt a bit, the experience that you get can be felt just on the words that they use. And we study this a lot in physiotherapy, because if we say to you, oh, it's damaged, it's broken, it's ripped, it's torn, we know that those words provoke emotion, and those in the brain, in a much deeper level, that can cause issues with how you perceive that pain. And that's evidence, that is a fact. Like, however much you think, oh, it's not in my head, it's not that anyone makes it up, it's not anything to do with that. It's a physiological response that's going on within the brain of how we're perceiving the pain. And so that's why when consultants say things like crumbling bones, like, what does that make your brain perceive? It's awful. So we need to get away from that. So don't be saying that to your parents. Like, if they've been diagnosed with osteoporosis, don't use language like that. It's especially with something like osteoporosis, we need to change the language that we're using, because it makes a massive difference. And that's why it's important that you go to someone that's qualified if you're looking for something like this sleep stuff, because you don't know what you're unraveling if you're not qualified. Like, someone might say something completely innocently but not realise, the consultant it doesn't say, oh, your bones are crumbling because you've got osteoporosis, because they want to make the patient's pain experience worse. Like, they don't realise what their words are saying to the patient and what the patient is perceiving. Because of course the doctor has lots of education. He's looking at it, he's saying, okay, so osteoporosis, I always kind of compare it a bit to like if you have a crunchie. So if you have a crunchy bar, you've got the chocolate on the outside, that's the outer part of the bone, and then you've got the honeycomb inside, which is kind of like the centre. And with osteoporosis, those little holes within the crunchy inside, the honeycomb, are getting a little bit bigger, and you can get little fractures. But that's very different, and sometimes you can get fractures of the chocolate, of the crunchy, but that's a very different imagery to someone who just feels that the whole crunchy is disintegrating and not understanding that it can just be tiny little fractures inside, which can lead, yes, osteoporosis is a problem, but we know that if you strengthen, if you do longitudinal pressure through the bone, if you do strengthening exercise, we can help to prevent it. So let's stop focusing on scaremongering and making people fearful of movement, and actually educate them and say, right, this is what you need to do if you want to achieve this. And yeah, and I'm just talking about sleep at the moment because that's what I'm listening to at the moment, and I'll keep doing this, guys. I want to disseminate all this information. You might read the sleep book and you might be like, oh, it's boring, I don't like evidence, I don't like that, but the way that he relates things, I think is really good, and I think it's really approachable, and even for someone like me, like, I understand it, and I hope other people will as well, because, you know, well, it's such a great investment in your time just to listen to this book. It might take 10 hours, which is quite a long time, but it might take 10 hours to listen to it, but if it helps to reduce your risk of heart disease, cancer and stroke, I don't understand why anyone would not do that. Like you spend loads of time watching TV, just listen to it while you're in the car. All right then, guys, that's probably enough moaning and ranting. Adela, one of my the girl I have a horse, and in the morning she's always laughing at me because I'm always having these rants about empowering people, and sometimes occasionally moans as well. Yeah, I really want people to be able to be educated about their health and take it into their own hands and not feel like they're not in control, because you are in control. We can empower you, we can teach you, we can educate you, and it's really important. All right then, guys, I'll see you later on. Have a great day. Bye bye.